I'm with ROE Dental Laboratory. I've spent the most of my career with ROE Dental Laboratory. We're a full-service laboratory. We do a lot of great things there at ROE, but one thing we do and have a lot of expertise in is full arch restorations. This is a focus of our business, and it gives us a particular insight into this type of restoration and then the needs of the market and our clients. And we certainly see the need for a lower cost restoration in the market. The reason for that is that, as mentioned in our opening monologue, that of all the patients in America that have no teeth, that need restorations, less than 1% are getting those restorations. And the number one reason for this surely is cost. A lot of patients can't afford this treatment. Not only can they not afford to be presented with treatment, they just know they can't afford it right out of the get-go and aren't even going to the dentist to get quoted on it because they know they can't afford it. But what if the industry could provide a premium full arch implant-supported treatment option at half the cost to patients that otherwise could not afford it? I think we can do this as an industry, and I think we can to accomplish this, we need to have lower costs. We need to get predictable success because these patients can't be returning to the office for breakage and failures. It's not sustainable, and doctors won't accept these patients if they know they're not making money on the treatment and it's not being successful for their business. And the number one thing we need to do is reduce the number of clinical visits, because that's the most expensive part of this cost is the doctor's time. And the solution that we're going to suggest is, in essence, a digital solution. And with digital solution comes the digital records. And it's really important to start out with great digital records. And the one digital record that we miss a lot that can make a very big impact on the success is photographs. With these photographs, we're able to position teeth in the right place in the patient's mouth so that we can decrease appointments and not have resets and redos and prototypes that need teeth aligned. Giving us a great picture of a bite block in place or the patient's natural teeth in place pre-extraction is really hard for a dental technician to make a mistake on putting a midline off or length of teeth. Even more so, digital 3D imaging of the patient's face is a fantastic tool and is really a photograph on steroids. We love getting these in. There's several systems on the market. They all work. At this point, we're most enamored by Shining 3D's MetaSmile just because it has a low price point, gives a great information. But the Ray Face, the Face Hunter, there's cameras that you can connect to SLM cameras that work great as well. When it comes to choosing a material for this protocol, we're going to pick a material that we can put in as the immediate load prosthesis, and that can be the final restoration. So it needs to be strong enough to stand the test of time. This is going to, like I mentioned before, it's going to be a digital process where we design the dentures in 3-shape, and we're choosing to use the Ivotion pre-milled disc because this provides a lot of strength for our restorations. What is Ivotion? It's a highly cross-linked PMMA material that comes in a solid puck. It's a state-of-the-art production process, and it produces a very uniform, dense structure. And what the key to it is shell geometry that it makes. So it actually, we mill the denture, that's an actual denture that you see on the left. We mill the denture in a puck and it mills out with the teeth all in one setting. So there's really no bonding of material, adhesion issues, teeth to fall out, and it's based on this unique concept of shell geometry. So why Ivotion? What are the material properties? So their studies have shown that Ivotion is significantly stronger than other options in the marketplace. So it's 2 times stronger than conventional denture. And at the bottom graph, it's wearing as well as teeth that have been in the market in millions of patients for decades. The Vivadent PE teeth, it's wearing at a very similar level to those teeth, which have been very popular for many, many years. So in doing tests, one of the tests, we're going to show some factors, load to failure. On the first molar, this is an important test to determine if this material is appropriate or not. So in load to failure, the Ivotion denture in the middle was stronger than basically a Ivo base, which is a very advanced, much more advanced than pouring a denture processing technique, but yet conventional processing technique. And it was more stronger than a Lucitone print denture. So of the digital options, it's stronger. And we even did these tests, load to failure tests. We sent them a samples of dentures with holes in them, like converted dentures that they would have. And those dentures even proved to be stronger than the conventional Vivadent Ivo-based dentures and injected dentures. So load to fracture, very similar. The Ivotion is very strong compared to its other options in the marketplace. And tooth debonding. The teeth are fully integrated into the base, so there's not a lot of debonding to take place. So it's no surprise that it comes in stronger than other options in the marketplace. And they've also found that it has less bacterial growth, and this makes a lot of sense. It's a very dense material, non-porous material, so there's nowhere for the bacteria to get in, and it prevents bacterial growth just using the Ivotion disc puck, which is super important for implant cases and the cleansability. Another super important factor in strength is that the case is passive. It must pass the Sheffield test. It must have a dead fit on the implants in order to make sure it's not under tension and breaks. There's a lot of ways to get passivity. You can use photogrammetry systems in the marketplace. You can use unique scan bodies such as the arch bridge or OptiSplint type techniques or grammetry type techniques in the marketplace. But you can also pick restorations up chair sides right into the prosthesis, which would also make them extremely passive as well. And that's what Dr. Deliberato is going to discuss in his presentation. So to get passivity as well, we need to make sure these implants are as parallel as possible and as aligned as possible so that the restoration is not under tension. So what Dr. Deliberato is going to reference and mention is a fully guided technique using a strong Ivotion prosthesis that is not under tension and passive and doesn't have holes in the restorations. So we can accomplish this by using a guided surgery method. There's several guided surgery methods in the marketplace. GuidedSMILE Chrome is Dr. Deliberato's preferred method for guided surgery, but it delivers bone reduction, osteotomy guidance, implant control, abutment timing, simplified prosthetic conversion, and simplified conversion to final. So we design this in software so everything is pre-planned out. In the case we're talking about with an Ivotion, a Locator fixed case, we even will put the Locator attachments on it so we can see the angle, what they're going in. There is really nothing to speculation and nothing to chance on this type of design and restoration because everything is pre-planned. Now we got to this point is for a long time we were doing cases with small holes with a method called C2F, which allowed using this C2F conversion kit and doing an extraoral conversion of a prosthesis. So the holes were just the size of the screw holes. And what that does for us, as it was shown in the earlier test, Ivotion was performing extremely well, even if it had holes in it, but those are large size holes that could pick up a temporary coping. With small size holes, it makes logical sense that there's more acrylic around it, should be stronger. But what if we took it up a notch, and what we're doing today is using the Locator fixed system so that we don't have holes at all in the restorations. There's multiple options depending on how many implants you put in the restoration, and we use the Locator fixed option, so it's a strong material and doesn't have holes in it.